It's TennCare and the law, and we're talking to Dr. Larry Woods of Tennessee State University and an attorney in Nashville, Tennessee. And of course, Dr. Woods, over the last segment here, let's give you an opportunity to perhaps pull out your crystal ball and look into the future in terms of where do we go from here dealing with the situation that we find ourselves in, dealing with TennCare.
As we were saying, it's critically important. People's lives, their health, their livelihood depends on the solution to this TennCare crisis. And there are several choices. Governor Bredesen's original proposal last year to solve the financial downfall of TennCare was to scale back the services, to cut the number of prescriptions enrollees on TennCare can get each month, with, of course, an appeal loophole for those that had a medical need for more prescriptions. His other proposal was to require some small amount of copays and other scaling back and cutting back in different areas to save money in TennCare. And the reason Governor Bredesen originally proposed it that way was if he could achieve those cutbacks he described, he could keep everybody presently on TennCare enrolled in the program. There'd be
Even though they
money.
might not receive full benefits according to what they had received earlier, but they would still receive some benefits.
That's right. As Governor Bredesen described it, instead of having a Cadillac health care plan, they'd have a Chevrolet or Toyota health care plan.
But
they'd
they would still
get coverage, still get health care. It just wouldn't be quite as good as it had been in the past, and that would save hundreds of millions of dollars. Governor Bredesen was not able to implement that new proposal because there are certain court orders in the United States District Court, in federal court, that limit the governor's ability as to how he can change TennCare. And I'll talk more about those lawsuits in just a moment. There are other proposals, both by the TennCare lawsuit advocates and by other organizations and people interested and concerned about TennCare as to how to save money. For example, one proposal made by both Governor Bredesen and by the advocates is we need to use more generic drugs rather than brand name drugs. And that's a step in the right direction. The problem is, the financial problem is, changing automatically to generic drugs will only save us about $10 million. Now, that's a whole lot of money to me, but to TennCare it's a drop in the bucket. It just doesn't change anything enough to make a significant difference. We need to consider going to therapeutic equivalents and therapeutic alternatives. That could potentially save hundreds of millions of dollars, but it's still down the road a ways. It's not going to help us today. So there are various proposals that I hadn't even gotten into to save money here and there in TennCare, and the problem is if we did all of them and we're successful in all of them, it's not going to save enough money. So we're left with, we're going to have to cut the number of people on TennCare then. If the federal court orders stop us from implementing a scaling back where we can keep everybody, which is what we want, then the other alternative is we're going to have to drop some people from the program. So the current proposal is to drop 323,000 people from the program. Keep all the children, whether they're eligible for Medicaid, TennCare or not, we keep all the children, but we drop over 300,000 adults. We'd rather not do that, but financially it's the only way to keep the program alive since the federal court orders don't allow us to do the original proposal. So let's talk about the federal court orders, because they impact so seriously on what we're trying to do. There are a series of 3 or 4 federal court lawsuits in the Nashville federal courts. They're called the Rosen case and the Greer case and others, primarily Rosen and Greer, the ones most active right now. There's going to be a hearing shortly in the Rosen case about Governor Bredesen's present proposal to drop 300,000 people from the TennCare rolls. And whoever wins that hearing, the other side's going to appeal to the Federal Court of Appeals in Cincinnati. So in the next few months, maybe in the next year, everybody's hoping in the next few months, we'll know what the court says about whether people can be disenrolled. Or technically, more correctly, it's not whether we can disenroll people from TennCare, it's more what kind of hearing and notice and appeal do we have to give people who are going to be disenrolled. if the federal courts stop the governor from limiting the enrollment, then we're back in the same problem again, $1 billion shortfall, and we've got to make it up. How do we do that? Ultimately, if the federal courts stop us completely in the Rosen case and others, then I hate to predict it, but probably what's coming is an end to TennCare, reverting back to Medicaid.
Now, what impact would that have? I mean, would that drastically undercut what we are doing here in the state of Tennessee dealing with TennCare? Or what impact would such a reversion have?
A reversion to Medicaid would be the most drastic alternative of all, because number one, it would knock several 100,000 people off their health care coverage, and number two, it would knock several 100,000 children off health care coverage and limit the enrollment so drastically that we'd solve this billions of dollars shortfall, but we wouldn't have health coverage
that's
for
what
many
we would be
people
just
that
as
need
bad in dealing with Medicare as we would under TennCare, wouldn't we? Under that kind of situation, would
That's
we
right.
not?
If we go back, if we have to go back, if the federal courts force us ultimately to go back to Medicaid, then hundreds of thousands of people are going to be in trouble, and hundreds of thousands of children, and the options, or rather the scope of the health care coverage is going to be severely limited compared to what the TennCare coverage is. So I don't think, the reality is nobody involved in the public policy disagreement wants to go back to Medicaid. Because of course what I also haven't said there is the federal matching dollars, if we go back to Medicaid, go down. Tennessee gets a net loss in amount of health care dollars it's receiving to take care of our citizens. So everybody loses if we go back to Medicaid. But we're under a state constitution that says we have to balance our budget. So we may have no choice. Our hands could be tied in this by the state constitutional requirement that we have to balance that budget. And that makes your earlier question about the federal court lawsuits all the more important. The federal court lawsuits lay out mandates for what kind of notice has to be given, what kind of appeal process has to be involved for someone who applies for TennCare or gets disenrolled from TennCare. You know, the state right now is trying to do everything it can to get those federal court lawsuits changed, but unfortunately they were litigated 5 and 8 years ago for the most part. They're over. The state's hands are bound under those lawsuits, and achieving any change at this point requires a negotiated settlement with the TennCare advocates involved in the lawsuits, and thus far they have not been willing to accept any of the settlement proposals that the governor has made to them. That's why we're back in federal court very actively fighting about the matter right now, because with the balanced budget requirement under the Tennessee Constitution, you know, if we lose the negotiations, if we lose in court, then we're really left with no alternative except going back to Medicaid, and that hurts everybody across the board. So that's why we're struggling right now with the TennCare advocates and struggling with the federal court lawsuits.
It would be best if we could work out some kind of negotiated settlement with the TennCare advocates as well as the federal court that would that would allow for the elimination of at least a number of individuals, but keeping the children. Would that be an alternative?
It seems to me that everybody's got the same interest at stake here. You know, we're all in favor of health care. We're all in favor of kids and everybody else having health care coverage, and the confusion, rather the disagreement, is how do we reasonably at an affordable cost provide that? Private health care and employer paid, partially paid plans help with that, but don't cover everyone. So we've got to have public money, the government, provide for kids. We've got to have a TennCare type plan, and because of the Rosen and Greer consent decrees in federal court, we're required to provide things that are costing us too much money. That's not criticism of the federal court, that's just the reality. So the best thing to be achieved is to work out a compromise with the federal court system, with the advocates in the federal court cases, to where we can cut back the services and provide coverage for everyone.
Okay.
Failing that, we've got to eliminate some people from the program and send them back to CHIPS and Medicaid and other federal programs.
Okay, very good. And Dr. Woods, we've got about 10 seconds, and this show will be over for the day, but let me thank you for bringing that information back to us. And let me encourage our audience to tune in again next week for another informative edition of Comments. Thank you, and good morning.